Good evening. I'm Dr. Sten Ekberg. Thank you so much for coming here. This is User Manual for Humans Part 2. And we had Part 1 last week. We'll do a little bit of review. We'll do that every time because there's some fundamentals. And if you recognize them, then it's just your opportunity to learn it even better. Some of these basic concepts, such as sympathetic, parasympathetic, which is fight, flight, and feed, breathe. These are so fundamental for your health that I think you should know them to the point where you can teach them to someone else, that you can save their life doing that. We started talking about stress, and today we'll talk specifically about what is the link between stress and diseases. All the stuff that people complain about and that people suffer from and that people take medication for, how does that actually come about in the body? And you can mark off on your little outline there if there's something that you specifically would like to improve, if it's pain, weight, blood pressure, cholesterol, diabetes, or if there's things that you just want to learn more about. When we talk about health, first we want to find out and define and know that we know what health is. Because most people say, hand raise, how many people want to be healthy? Good. What is health? We want it, but what is it? So, simply put, health is when everything is working the way it's supposed to. And that is completely different from the general opinion that health is simply when you don't have a disease. If you go to the hospital and they say, well, do you feel healthy, or whatever, you get a clean bill of health, that just means you don't have a disease, you don't have a symptom. Well, you can have a heart attack tomorrow, but according to their definition, if you don't have a symptom today, you're still healthy. Well, function, which we talk about here, is a much better way of defining health. Health is when everything is working. Another way of saying that is because your brain and nervous system regulates everything about your body and everything about your experience. Another way of expressing health is to say when your nervous system can receive and appropriately process all information in your environment. And that's the key, appropriate. In order to understand the body, we need to figure out when something isn't working in the body. Would you agree that if you have pain, that there's something that's not working? That if you have a symptom, there's something that's not working? Well, what is it that isn't working? If we think of the body as having 3 levels of function, the lowest level is passive tissue. That's bone, cartilage, fluids, blood, fat tissue. All those tissues, they give the body structure, they provide attachment points, but they don't take any action and they don't make any decisions. They're passive tissue. They're important, but they don't do anything. Next level up is active tissue, and that's muscle. Muscle, which includes your heart and your digestive tract and your blood vessels, they take all the action, they perform all action, but they still don't make any decisions. The next level up is brain and nervous system. That's regulatory tissue, and that's where all the decisions are made. So if we truly understand this hierarchy of passive, active, and regulating tissue, then we understand that the brain and nervous system is where all function is, and it's where all problems are. So if there's something in your body, if you have a symptom, there's something in your brain that isn't working. It's the only place, it's the source of the problem. Make sense? Mm-hmm. Now we know those functions. Now we're going to talk about the autonomic nervous system. So everything in your body that happens without you thinking about it is handled by your autonomic nervous system. And that nervous system has 2 branches. It's called the sympathetic which is fight, flight. Sympathetic and stress both starts with an S, so you can help remember. And the other branch is parasympathetic, or feed, breed. One helps your body defend itself. So whenever your body needs additional resources, when it needs to expend energy for physical effort, that's called defense. So if there's a grizzly bear that shows up, then your body wants to be in a state of emergency. You want to allocate resources so that you can defend yourself and save your life. Parasympathetic is about health. It says when the danger is over, when the grizzly bear is gone, now we can allocate resources inwards to digest food and send energy to our immune system and our reproductive systems. What we really have to understand, as you see in the slide, there is a seesaw. There's a balance beam. That means that when one side increases, the other side decreases, always. And this is so key and so fundamental to understand, because if one side is defense and one side is health, that means we can't do both at the same time. Your body is always making a choice between the two. So let's see a show of hands. Between defense or health, which one is more important? Who says defense is more important? And who says health is more important? And how many people are on the fence? All right, we got one of everything. So it's kind of a trick question, because both are absolutely essential, but they're essential at different times. The defense is about surviving this moment. Health is about surviving till next year. So the hierarchy, the priority in the body is defense, sympathetic, always comes first. Always. Because if you don't survive the next few seconds, there's not much point to anything else, right? And it makes a lot of sense. If you're right in the middle of the battle, you don't sit down to have lunch, right? And so the body, that's the body's priority as well. And that's so important to understand, because it means whenever we have a sympathetic response, whenever we have a stress response, we cannot heal at the same time, at least not completely or adequately. What this means is that there are physiological changes in the body when we switch in the system from one to the other. And we want to start thinking this as resource allocation. How do you allocate resources in the body? What carries the resources in the body? Well, it's the blood, right? Blood carries oxygen and glucose and minerals and nutrients, and it carries the waste products out. That's the transportation system of the body. So just like you're driving your car and you want to speed up, you give the engine more gas, you rev it up. You want to give a body part more energy, you send it more blood. Okay? It's as simple as that. So resource allocation is simply where do we send the blood in a given situation. So when we have a stress response, we want to send the blood to the places that can save our lives. And when we have a parasympathetic response, when the danger is over, then we can send the body to the digestive organs to heal and get healthy and procreate and regenerate. Next is just a little cartoon. It's one of my favorites. Glass Bergen, he does a lot of funny stuff about health. This lady says, "Don't tell me to improve my diet. I ate a carrot once and nothing happened." And I like this guy because he perceives the flaws and the weaknesses in humans and in the system. But that's how a lot of people think. They don't understand that it's about function and it takes time to build a system. So we expect something to do something. We take a pill because we want it to do something. We take supplements to do something. That's not how it works. We take something if we need it. If we need something and we provide it, we're better off. If we take something and we didn't need it, it makes no difference. It's not supposed to do anything. All right? So now we're moving into that was pretty much review. So now we're going to spend a good amount of time on the next 3 slides, 7, 8, and 9. And this is where we're going to show you, so you will get a whole lot smarter than 98% of the doctors out there. Because they will tell you that we don't know where these diseases come from. They'll say the cause is unknown. And I'm going to show you exactly where they come from. It's not a mystery. It is a mystery if you're looking in the physical tissue for the cause, but it's not a mystery if you start looking at function and understand how the body works. And it's all based on this, sympathetic versus parasympathetic. Accounts for 99% of all the diseases. So let's just read through some of the things here. High blood pressure, high cholesterol, those both relate to cardiovascular disease and heart attacks. Raynaud syndrome, that's a lot of women especially have cold hands, and they have cold hands to the point where their fingers get white and they're almost hurt. Neck pain, headaches, diabetes, constipation, blood clots, obesity, infertility, miscarriages, erectile dysfunction, digestive problems, ulcers, allergies, autoimmune diseases, rheumatoid arthritis, and cancer. We got a pretty good coverage with that list, okay? Now let's look, next slide. We're going to go back and we're going to tie this together, so don't worry about missing stuff. And there may be some other drugs here, but I just kind of went off the top 10 list just to get some examples. And there's simvastatin, it's a cholesterol lowering, it's levothyroxine, which is for thyroid, lisinopril for blood pressure, hydrochlorothiazide for blood pressure and fluid retention, atenolol, blood pressure, metoprolol, succinyldir or something, blood pressure, amlodipine, blood pressure, omeprazole, ulcers, and GERD, which is gastroesophageal reflux disease, as they call it. Metformin, type 2 diabetes, furosemide, which is diuretic, and then there's an array of over-the-counter medication, which are primarily for cold and cough remedies, allergy relief products, antacids, and laxatives. Do you see a pretty good fit between the drugs and the problems up above? Not complete, but there's like better than 50, probably 80% correlation there. Now let's look at the mystery that they're telling us, that we don't know where these things come from. Well, in the stress response, when we have a sympathetic response, when the grizzly bear comes charging, what happens in your body? That's going to be on the left side of the next diagram. That's called the initial adaptive stress response. So what happens is your adrenaline and your cortisol goes up. Your glucose, your blood sugar goes up as a result of cortisol. You increase your energy mobilization. You increase your cognition, which is your alertness, your mental powers, if you will, for that situation. You become clearer. You increase your pain tolerance. You increase blood clotting factor. You increase your blood pressure. You increase your skin conductance. And you increase your brain activity on the beta wave, which is the high frequency. Okay? So let's go back and see, why does this happen? Well, here's the grizzly bear. Do you think adrenaline is a good idea to get you that burst of energy? Probably so, yeah, that sounds life-saving. Cortisol, in the following minute, cortisol is released to increase blood sugar. Sounds like a good idea, because blood sugar is the energy for you to sustain the fight. And in order for you to get that blood sugar, you also decrease your sensitivity to insulin. You become insulin resistant. Okay, we'll just kind of put that out there for now. Energy mobilization, obviously that goes with the adrenaline. Cognition, you want to be bright and alert, you want to evaluate your options. You want to see where you can get away. Do I climb a tree? Do I grab a club? What do I do? Pain tolerance, increased pain tolerance. That also seems like a good idea. You don't want to worry about every little ache and pain. You want to get out of there. So that becomes second hand. Blood clotting factor. Why would you want a blood clotting factor? Well, what if you run through some thorny bushes? What if the bear gets a few scratches in on you? You want to be able to stop that bleeding quickly. And that's what the blood clotting factor and the stress response does. Let me add one thing to that. Part of the blood clotting process is cholesterol, LDL cholesterol, because the LDL cholesterol takes cholesterol out to the tissues and into the blood so that you can close up the wound quicker and so that you can rebuild cell membranes quicker to repair the damage. Your cell membrane is 13% cholesterol, so you need a lot of cholesterol to repair damaged tissue. So this is all part of the stress response. Obviously your blood pressure goes up, so you can squeeze the blood out into the body parts that need it quicker. Skin conductance, that's the moisture on your skin. Okay, people with sweaty hands. Why does that go up? Well, if you have dry hands and you try to grab a club, you might slip. But if you're a little bit moist and sticky, now that you get a really good grip on that club and that tree branch, so it increases your chances of survival. All these things have been built into your body to increase your chance of survival, right? So let's go further here. We have a decrease in digestion, okay? Well, why would we want that? Digestion is good, right? But it's not going to save you against the bear. Your stomach acid is not gonna, unless you throw up on the bear, but really for the most part that digestive process isn't gonna help. So let's put those processes on the back burner and focus on saving our life with the bear. So that's what drives this whole system. Sexuality. Well, sexual function or erections or ovulation, they're not going to do much for the bear. Right. we assume, right? So they're going to be turned off. They're going to be a lower priority while we have a stress response. Reproductive hormones. The female is not going to say that, well, you know, grizzly bear's here. I don't think I want to reproduce right now. So the body has it figured out. Growth and healing is not a priority, and extremity temperature goes down, so your hands get cold. Well, that's just kind of a byproduct of vasoconstriction. When you raise blood pressure and you constrict blood vessels, the fingers, the skin in the fingers, that's just not a high priority. Warm skin isn't going to do much for you, so that blood is needed elsewhere. And so all these things that happen, they're a direct, immediate result of the stress response. So let's go back up and look at health issues. High blood pressure, well, we got that one accounted for. That's pretty plain. High cholesterol, we've got that one accounted for. Raynaud's syndrome, cold hands and fingers, yeah? Neck pain, not so totally obvious, except that when we have a stress response, we increase muscle tension because we want to, that increases our readiness and our alertness, we can get out of there quickly. So, but if we have that neck, if we have those muscles tense for a long, long time, when there's no bear around, well, we're probably going to get some neck pain and quite possibly some headaches as well. Diabetes, we covered that because the cortisol will increase blood sugar, glucose, and it will increase your insulin resistance. It will decrease your sensitivity to insulin, which is the first step toward diabetes. Constipation, okay? We sell all these laxatives, and constipation just says, well, you know, I'm not going to expend energy moving my gut when there's a grizzly bear. Blood clots, well, that comes from the blood clotting factor. Your blood is a little bit thicker than it should be, so that you could stop bleeding if you had an emergency. Obesity, this is a separate seminar altogether, but just real quick, that the obesity comes from when the cortisol raises your blood sugar because your body thinks there's a fight here, I'm going to have to expend energy. So you raise the blood sugar, but if there is no actual fight, if there's no actual grizzly bear but only a perceived danger, then that blood sugar is going to get converted into storage, and the only thing we can store in any large amount, is fat. So if we constantly have a lot of cortisol, then a lot of that blood sugar is just going to turn right around to fat. Okay, that's why people get bloated and overweight when they're on what's it called, corticosteroids for any length of time. Infertility, we got that one accounted for. Miscarriages, we got that one accounted for. Erectile dysfunction, digestive problems, ulcers. Let's talk about ulcers just a little bit. Do you know what actually causes ulcers?
The bacteria?
Exactly. For the longest time, they just looked at the stomach and they said, well, it hurts when I have more stomach acid, so the stomach acid must be the problem, and therefore ulcers are caused by stomach acid. Then this guy came around and found that it was an actual bacterium, that it lives in your gut, and if there's an overgrowth of this bacterium, it eats away at the lining of the stomach and you get an ulcer. But this bacterium is very sensitive to acid. So the ulcer is not caused by too much acid, it is caused by not enough acid. So when you have a functional system, when you have your parasympathetics and your digestion functions, you make more stomach acid that keeps this bacterium under control, and you don't develop ulcers and they heal up. The problem is that they look at it the wrong way, so they say, well, it's the stomach acid hurts, so we'll give you something to reduce the stomach acid even further. So they're making the problem even worse. Well, now you don't have the pain from the ulcer, but you can't digest food. Your ulcer doesn't necessarily heal, you just don't have the pain, but now you're getting all sorts of problems down the road because you're not absorbing nutrients from your food. Allergies, they have to do with an imbalanced immune system. That's a separate, takes a little bit long to go into. And autoimmune diseases, rheumatoid arthritis, and cancer. These are all immune system functions. Okay? What happens when you have a stress response? You shut down your parasympathetic response, right? Your parasympathetics is what runs your immune system. So anytime that you have a stress response, you shut down your immune system. How many students get sick around finals time? Do you have an increase of colds and flus?
Yes.
Okay, right there. You have all this evidence right in front of you, and all you have to understand is what the sympathetics and the parasympathetics do in your body. It accounts for everything that happens. Okay? So all of these drugs would be unnecessary if people learn to balance their sympathetics and their parasympathetics. So now let's just look at the second half of number 9 there. We covered what happens initially, because when the grizzly bear is around, that's an appropriate response. That's an adaptive stress response. That's something we want to happen. But if this goes on for a long, long time, what happens then? And that's the problem, because your body only has one stress response. And it doesn't matter if it's a grizzly bear or if it's a pile of bills or rude people or gas prices or bad news on TV. Anything that makes you feel tense or uneasy or that puts you in defense, like you're trying to attack something, even if it's just imaginary, it will trigger the same exact stress response, but to a lesser degree. But whereas the bear eventually, he eats you or he goes home, these everyday stresses, they never go away. They're with you. You wake up with them, you add to them during your day, you go to bed with them, and you wake up the next day and they're still there. So that's why it's so important to understand this stuff and to learn how to adapt a lifestyle where you modulate your stress a little bit better. So what happens when we have a prolonged stress? Now, instead of adaptive, we have a maladaptive stress response. So now you have a decreased immune response. Your immune system doesn't work anymore. Whereas before you had an increase, temporary increase in alertness, now you have a decrease in memory and learning. You have a decrease in reproductive function, and here's a big one. Whereas before you had an increase in pain tolerance, because that helps you survive your grizzly bear, over time this breaks down and you have a decreased pain tolerance with chronic stress. This is a huge factor in why so many people are experiencing pain. For no other reason, there's no real cause for the pain except their sympathetics and parasympathetics are miswired, so they perceive pain because they have a reduced stress pain tolerance. Also, skin conductance. This isn't necessarily life-threatening, but it's worth noticing. In an acute stress response, your skin conductance goes up, but with a chronic stress response, you kind of wear out that response. It says, I'm tired, I'm not going to respond anymore, so you get chronically dry hands. So let's look at the rest of it. We get an increase with insulin resistance and therefore weight. We get an increase in fatigue. We get an increase in chronic blood pressure called hypertension. And this is the big one. It's the biggest selling medication. You see, half the list of the popular drugs are blood pressure medication. And in the medical books, it is called essential hypertension. That means they don't know where it comes from. And if you read the textbook, it's right there. This increases blood pressure. That is the cause. But because they can't find a physical molecule that they can pin it on, they say it's unknown. Okay? It really beats me, but we have increase in respiratory problems. We have an increase in opportunistic infections because of the reduced immune response. We have an increase in bone decalcification. That's osteoporosis. We have an increase in autoimmune disorders. Psoriatic arthritis, rheumatoid arthritis. We have an increase in strokes and cardiovascular disease, and we have an increase in digestive illness. So do you see how all of these three slides, how perfectly and exactly they fit together? And how that it really is no disease out there that is not a stress problem. They have officially recognized that 95% of all doctors' visits are stress related. I think that's an understatement, because I think anything that's not an acute trauma, like a car accident or a broken bone or a gunshot or a knife wound, those are traumas. I think everything else is stress. Absolutely everything. There may be an exception here or there, but. So all of these mysteries now, that when you read the magazines and the journals and they say, well, we don't know what causes it, we don't know. Well, now you know. It's right there. And all you have, and this is not unknown, it's not a secret. It's in the introductory textbook for medical physiology. It's just that nobody applies it and the reason we don't apply it is that we're so biased, we're so hypnotized in believing that the physicalness of our world is the most real one. We don't believe in things we can't see, and we can't see function. It's harder to quantify function than 2 inches of finger or a pound of weight. Those are very easy to quantify, and that's why we're stuck in this erroneous model of the body, where it's all a machine with different parts that we can manipulate. It's all about function, it's all about brain, and how the brain allocates resources in our body based on the situation we're in. When there's a grizzly bear, that's an appropriate response. When there's no grizzly bear, it's an inappropriate response. And that accounts for 99% of medical bills. Very good. Any questions on that so far? Got it all covered? Now let's just wrap up and talk about what do we do about this. So everything in your body that isn't working is a habit that's gotten stuck. Everything that you've ever learned, every skill, every pattern, every belief that you have is a neurological pattern. It is something that you receive a certain stimulus. You're like a Pavlov's dog. You just initiate that pattern, you kick it off, and it runs automatically. That's where all of our reactions and virtually all our behavior comes from. So whatever is working or whatever isn't working is a neurological pattern. So the first thing that we need to do to change is to interrupt that pattern. There are many, many ways of doing that, but we just need to interrupt it. One of the absolute most effective ways is the chiropractic adjustment. And we can show you the research, we can show you the neurophysiology, that the adjustment interrupts that pattern. That is what it does. You can do this with many different ways. You can change your thoughts, you can change your belief system, you can start meditating, you can exercise. The problem is that it takes a lot of growth. And for most of us, it's going to take years or decades to get to that point where we can change them on our own. So in the meantime, we can get it kick-started by getting adjusted. Now we've interrupted the pattern. Number 2, we need to restore balance in the nervous system. So how does imbalance develop? Where does it come from? Well, let's say that, first of all, every cell in your body needs food and stimulation. It's called use it or lose it. So how do you stimulate a brain cell? You send an electrical signal. The brain is designed to process electrical signals. So in order to stimulate and use the brain, you send an electrical signal. Okay? You stimulate a muscle cell by putting tension on it, because that's what it's designed for. You stimulate a bone cell by putting weight on it in a field of gravity, because that's its purpose. So how do you send electrical signals to the brain? Is you fire off receptors. Receptors are little things that sit all over your body and inside the joints, and every millimeter of tissue has receptors that convert signals and movement and things in your environment into electricity so that your brain can process it. So where does imbalance come from? Well, if there is an imbalance in the way that signals come into your system, if there's more signals coming in on the right side of the body than the left side, then the left side, one side is going to get more used than the other, and then you will develop an imbalance. Just like a tennis player is going to have a bigger, stronger arm on the one he holds the racket. So the reverse holds true. If you don't use something, it's going to get weaker. So if you break your arm and put it in a cast, then that muscle is going to atrophy. And the pathway to the brain is going to get used less, and that area in the brain that receives that information is going to get weaker. Just like that arm, just like that muscle does. So let's say that you sprain an ankle and you limp around for a couple of weeks, and then it feels all better and you don't think about it. But during those 2 weeks, you change your gait. So now you're pushing off 1% less with that leg just because you developed that habit. Well, that's an imbalance. That means there's less pressure, there's less signals being sent on that side, so your brain develops an imbalance. So how many things do you think have happened in your life where you've had the risk or chance of setting up an imbalance? You probably had something every week of your life. All right? And we need to understand this is where imbalances come from. And the long-term effect of weakened brain function is called aging. And things like Alzheimer's and what's the other big one? Parkinson and so forth. They're just areas in your brain that get too weak to function anymore. And they just haven't been stimulated. So that's where the imbalance comes from. How do you rebuild the balance? Chiropractic, exercise, breathing exercises. You send an increased and different kind of signal to the brain. That's how you rebuild it. Third, rebuild strength and stability in the nervous system. That kind of goes with number 2, chiropractic and exercise. The problem with exercise, though, is that if you have an imbalance between left and right, and you go and work out, you're going to maintain that imbalance. You're going to increase both sides, but the imbalance is still there. That's the strength and the uniqueness about chiropractic, is when we find a leg length difference, when we find a weak muscle, when we find something that isn't working, and we make it work, we have helped restore that balance between left and right. All chiropractic techniques are built in some way around the difference between left and right. And when we can even something out, we have evened out the brain balance. Then you go and exercise and stretch and do yoga, and you amplify the effect and you activate those pathways. So the last one is reduce stress. Since we know that the stress is what interferes with the system in the first place, now that we have rebuilt the strength and the balance in the system, we need to reduce the stress. And how do you do that? Chiropractic, exercise, and we start slowly and gradually and surely to cultivate some inner peace. There's many different ways of doing that. Some people pray, some people go to church, some people go out in nature, some people pet their dogs. it all works. Okay, but we need to do something consistently to increase our ability to feel good. All right, now we have restored health. What is required to maintain it? So, if you have a plant and it's wilting, what's the first thing that you're going to give it?
Water.
Amen. So you feed it, you give it some water, and it's still not looking happy. What's the next thing that you try? Take it out of the closet?
Take it out of the closet, yeah.
Give it some sunlight?
Oh, I put it by the window. I just did that to my plant.
Yeah.
It's got a little yellow.
And so you give it water and you give it sunlight, and it's still not happy. What do you do?
Maybe repot it, change the soil.
Exactly. It has to have healthy soil. It needs nutrients and not too many toxins. So you can ask a 5-year-old what it takes to raise a plant. It's going to tell you need soil, you need water, you need sunlight. And then let's turn the question around a little bit. And let's say that you try 1 million times to raise a healthy plant, but you only give it 2 out of those 3. You give it soil and water, but no sunlight. You give it soil and sunlight, but no water, and so forth. You try 1 million times, how many healthy plants are you going to end up with?
None.
0. That's what required means. If it is required, you have to have it. Okay? And if there are 3 requirements, you can never ever get away with 2. Okay? So now the good question that we're interested in is, what do humans need? What is required for humans? And we basically have nutritional, physical, and emotional requirements. We need good food, we need movement, and we need to feel good. So simply put, eat well, move well, think well. Now, these are requirements. So how many times are we going to be successful trying to achieve optimal health with 2 out of 3? Can't happen. Okay? So your system is designed for food. It is designed for movement. It is designed to feel good. You cannot achieve optimal health if you don't do all 3 of those. Movement is not optional. It isn't. Okay? That is about all we're going to cover for today. So just to end up, I'll ask you to think about if you enjoyed, if you got something out of tonight, if you learned something that you think maybe someone else need to hear, then please put down some names of some people that you care about and feel free to invite them next time. Thank you.
Thank you.